transmission in February. I do remember what we were being told. I do remember the view around the cabinet table. I mean, the one thing that has troubled me a lot, I'm sure we'll come on to it, is the March discharge policy, where clearly the question of asymptomatic transmission would be relevant.
I'm so sorry to interrupt. Can we come back to that? There's an important contextual position which has to be set out for the purposes of that debate. There is evidence before the inquiry that the chief medical officer told Mr. Hancock at a meeting on the 28th of January that there was credible evidence of asymptomatic transmission within Germany. Was that a fact of which you were aware? Did you know that?
No, that CMO's...
Mr. Hancock had been told there was credible evidence of asymptomatic transmission within Germany at a meeting on the 28th of January.
Well, if I was told that, I've completely forgotten it. My memory of the asymptomatic transmission issue is...
These people are criminals. They're going to have to go to prison. None of them is going to escape prison as long as I'm alive and can testify. COVID was a coup d'etat, okay?
Of running government. From the viewpoint of the bereaved and those who are terribly damaged and harmed by this pandemic, how could a government have generally failed to stop and think? The system is there to make you think. The risk assessment processes and civil emergency procedures are there to make sure that you don't have to stop and think. It responds. But on this occasion, generally, and it's not a personal point, generally the system did not stop and think and say, this data shows there is a greater problem than we currently understand.
I think that's... I think I've tried in a way to give you the answer to that. I think that what really happened was outside our living experience. We hadn't seen something like this for a century or more. And unfortunately, what we did remember was not helpful. Because what the system did remember, was things like SARS and MERS and swine flu and so on. Other zoonotic diseases that certainly had an impact in Asia, which is what we were seeing, but ultimately were relatively, if not wholly, benign in the UK. And if I had to guess an answer to your question, Mr. Keith, I would say that was probably the default mindset, and that was basically because of people were operating on the basis of their lived experience.
So a failed mindset.
I think it was a human natural response of people based on what they had themselves seen and observed in their lifetimes.
But from the context, from the prism or from the viewpoint of the efficacy and the competence of the government response, regardless of the psychological issues that may have been preying on the minds of its constituent individual parts, that the government failed to wake up, did it not? It failed to understand the significance of the crisis, and therefore, it must follow, failed to take steps speedily enough.
I think that it would certainly be fair to say of me, the entire Whitehall establishment, scientific community included, our advisors included, that we underestimated the scale and the pace of the challenge, and you can see that very clearly in those early days in March, from late February through to the sequence of NPIs, of lockdowns. You can see that we were all collectively underestimating how fast it had already spread in the UK. We underestimated. We put the peak to too late. The first peak too late. We thought it would be in May, June. That was totally wrong. I don't blame the scientists for that at all. But that was the feeling, and it just turned out to be wrong.
But the evidence before Milady shows that the scientists, at least in part, were aware by the end of January of the hospitalization rate, of the fact that the number of infections was being grossly underestimated, that there was self-sustaining human-to-human transmission. They were aware by the beginning of February that there was no effective test, trace, control, isolate system in the United Kingdom. So once the virus spread beyond China and became self-sustaining, there was no effective means of stopping its entry into the United Kingdom. That was all known to the scientists, at least by the beginning of February. Why wasn't it known to the
on the test to trace
ministers?
On the test, trace, and isolate, on the whole diagnostics question, I think if you look at the evidence, you can see actually that we were being assured. I was being assured that we were in a good place on that until it became clear that wasn't quite right.
But I'm asking about the system. Forgive me. I'm asking about the system. If the scientists knew and had the data from which the government could draw the proper conclusions, why didn't the government systemically,
I think,
rise up in light of these alarm bells and do something?
Well, I don't wish to say that we were oblivious, because we weren't. And actually, a lot of work went on, a lot of planning, a huge amount of discussion. So I think, I'm talking quite a lot now. So I think the CMO first briefed me about it on about the 4th of February, and we talk about what could happen. SAGE, as you say, is meeting. It's not as though nothing is happening.
No,
I think that what is going wrong possibly is that we are just underestimating the pace, the contagiousness of the disease, and you can see very clearly from that crucial moment of transition from the 12th to the 13th of March, how radically the scientific appreciation of the situation changed. SAGE on one day was...
Forgive me, Mr. Johnson. I'm asking about January and February, where we haven't got to March yet. When did you first become aware that the test and trace system, whilst extremely efficient in practice, could not be extended beyond the first few hundred cases, that it was a system designed for high consequence infectious diseases? It dealt with travellers, it dealt with index cases, but it couldn't really be expanded beyond 10 or 20 index cases and 500 or 600 contacts.
Yes, you're going to have to forgive me, Ms. Kidd. I can't remember exactly when it became obvious that test and trace wasn't going to work, but there came a point quite early on when I think Chris or Patrick said, look, test and trace isn't relevant anymore because of the spread of the disease. I couldn't date that.
From which you then, of course, appreciated that if the virus spread outside China and was self-sustaining, and it had already...
Yes, I'm sorry, that was probably much later in March.
Or you think that was later in March?
I think so, but I couldn't swear to it.
There was a box note on the 30th of January, 136734. This is an email from a member of your office, Mr. Johnson, to post the private office support team. Grateful if you could include the below in the box tonight. Prime Minister, to be aware the Chinese government granted the permission for the flight to evacuate British nationals from Wuhan, so we're concerned here with repatriation. If we then go over the page, there's a reference to the WHO expected to declare a public health emergency of international concern. And then also to be aware the FCO is drawing down non-official staff across the network in China. The day before, on the 29th of January, there was a Cobra, 56226. You weren't, of course, at that Cobra, Mr. Johnson. You've explained how you didn't chair a Cobra until March. If we look at page 5, we will see that the chair, Mr. Hancock, hears from the CMO and Public Health England about the fatalities in China. There was evidence of human-to-human transmission, and Germany had 4 confirmed cases. And then at paragraph 3, the CMO said the UK planning assumption were based on the reasonable worst-case scenario. There were 2 scenarios to be considered. The first was that the spread was confined within China. The second was that the spread was not limited to China, and there would be a pandemic-like scenario with the UK impacted. The second scenario was plausible, but it may take weeks to months. The CMO sets out there in Cobra, and my lady's heard evidence on this, that it was understood that if the second scenario came to pass, there would be a pandemic, because once control had been lost, a viral wave was inevitable.
Yes.
This is a Cobra that takes place on that day, the 29th of January. The following day, you receive a box note, which appears to be solely concerned with repatriation. The question is, why were you, the Prime Minister, not being told directly, this is a virus which, if it escapes China, will result in a pandemic? There is information already that it has a very serious fatality rate and a very serious hospitalization rate. Why was that basic light bulb information not brought to your attention so that you could see the true nature of this emerging crisis?
I think that I can't give you the exact reason why that Cobra was not brought to my attention. That detail of the Cobra was not brought to my attention. But I can say that at that stage, I think that even the concept of a pandemic did not necessarily imply to the Whitehall mind the kind of utter disaster that COVID was to become. And if I may, and that may sound odd, but what I'm trying to say is that I think people were still operating they were still thinking about things like a flu, an influenza pandemic, or some of the other diseases that I've mentioned.
Well, this material, along with a plethora of other documents, shows that the reasonable worst-case scenario was already being envisaged, and that was a reasonable worst-case scenario which denoted deaths to the tune of 800,000 people. So it couldn't have been unknown to Whitehall, but you say the eventuality was not aware.
I didn't see that figure, and I saw a different figure, I think, towards the end of February, by which time our alarm was really truly raised. But I'm trying to give you my best explanation for why people were in the mindset that they were in.
There was a cabinet on the 31st of January, 56125. If we go to page 10, please, we can see the nature of the debate. It was, of course, chaired by you that afternoon. And the Secretary of State for Health and Social Care, Mr. Hancock, says 2 cases have been confirmed in the United Kingdom. They had been, of course, confirmed on the 30th and the 31st of January. It was a very serious problem in China, a large number of cases and fatalities. And then the debate moves on to the typical infection rate of 2.5 to 3 people, and the mortality rate 2%.
Yes.
So if the reproduction value is 2.5 to 3, that is to say 1 person will infect 2.5 to 3 people in an unimmunized population, and the mortality rate, 2% of people who were infected, or perhaps confirmed cases, is not clear, means a very, very large number of people will die. Correct?
That's right.
The debate in Cabinet, page 10 and 11, deals with repatriation. The Department for International Development examines developing countries where the risk of spread of the disease was high. spread of the disease globally would be a big problem for